recognized by veterinary services.
And you want to say that perhaps illegal ones even outnumber those recognized?
It is possible because we don't have veterinary people to do the meat inspection in those places because they are illegal.
Right.
So, but anywhere that it is a legal slaughter slab or point or slaughterhouse, you get veterinary people there doing the meat inspection. Yeah.
And that ensures that the meat you consume is safe.
That is it.
So the worry is about the illegal houses that are not registered. How do they get out of this? How are they able to operate without being found out and sanctioned and perhaps stopped?
Yeah, the only thing that we have started to do is that, now there's a passage of the Ghana Health Service Public Health Bill.
Right.
Public Health Act, Act 851. In that, there's a section that veterinary services has now been given the right to do both post-mortem and ante-mortem. So the meat inspection will be fully carried out in the whole country by veterinary doctors. And because of this, we are going to go on sensitization with the district assemblies. You know that all these slaughterhouses and slabs are under the jurisdiction of the...
all right. Dr. Kimoto, you hold it there. Let me speak to Mr. Kofiesel, the Senior Regulatory Officer of the Food and Drugs Authority there. Mr. Kofiesel, thanks so much for your time.
Well, thank you very much. I'm a Principal Regulatory Officer.
A Principal Regulatory Officer. Thank you. Thank you for the correction there. Now, the meat that we consume as Ghanaians, now, how safe is it from the point of view of the Food and Drugs Authority?
Well, thank you very much. Let me take this opportunity to also extend my greetings to your cherished listeners.
Right.
I think we are not seeing anything different from what my colleague from the Veterinary Services Department, Dr. Kikimoto, I know very well. He's my very senior brother. And so we are so concerned with the meat quality, meat safety that we are consuming in this country. And I'm very happy that he did mention that the new Public Health Act, the Act 851, have made some significant inroads as far as meat safety is concerned in the country. We have been jointly involved in a number of interventions. Lately, the one that was reported at Avinoy, for example,
right,
together with the AMA, the Metropolitan Health Directorate, to bring some sanity into the meat handling practices. As an authority, we are equally coming up with certain modalities, certain functional activities that we believe very well that, as is being done in other developed economies, we don't need to reinvent the wheel. We can adapt to these systems, and we believe we should be able to, as it were, provide that level of surety to the safety, as far as the safety of the meat that we are consuming in Ghana is concerned. We are doing a joint exercises. It's on the drawing board. And very soon we're going to roll it out. That would involve the veterinary services and the various local assemblies of the country, so that we can actively take into account the activities of these slaughter slabs and slaughterhouses scattered and dotted around the country, so that at any point in time, anywhere that anyone is buying meat, like Dr. Kikimoto said, the presence of veterinary services officials there, examine the animals before they are slaughtered, looking at the carcass after it's been slaughtered, are all part of the assurance.
Right.
And beyond that, we even have to look at how the meat is even transported and marketed. And that is also another area altogether. So supposing you even have veterinary doctors making sure that the meat is safe, what happens on the market when the meat is sent to the market? So we even have to look at the infrastructure of the market where meat is sold. Currently, our meat handling practices on our market leaves a lot to be desired, because meat is not sold from frozen chambers. They are sold and left in the open to the rigors of the weather. I mean, flies hovering over the meat and all that. So even when you have safe meat coming from the abattoirs or the slaughter slabs, you get to the market, the butchers have a role to play. And when you even buy meat from the butchery, you, the consumer, taking the meat home, how do you even handle the meat in the house, can equally make the meat unsafe. So food safety is a continuous activity that each player along the chain will have to be actively involved and sensitized, so that you can handle the meat very well. So it is not only with the quality and the safety of the meat at the point of slaughter.
Right.
But it goes beyond that, even to the home where the consumer finally prepares the meat for consumption.
How challenged is the authority? Dr. Kikimoto talks about illegal slaughterhouses. How challenged is authority in your collaborative role in checking this?
Well, like you rightly pointed out, it's a national difficulty that we all have. Okay, so his challenges may not be different from our challenges in terms of identifying all these, and then we have to work together with the local government. But again, let me refer to him.
Right.
The fact that these facilities fall under the jurisdictions of the local government. Okay, so they have to site a slaughter facility, and then you have state institutions working with them to ensure the safety of the animals and then the hygiene of the place where these animals are slaughtered and all that. And so we have to take it up from there. Okay, so the challenge is working together with the local government to ensure that local government have adequate funds and the resources to provide structured abattoirs or slaughter slabs for the various butcheries or the various markets dotted across the country. So if you have a situation where the local government is not in a position to provide that facility, then you start from ground zero, you have nothing to work with. And so it is a national issue which we have to sit down properly, draw a plan, and I know very well that the veterinary services has even come up with a model, slaughter slabs and things like that, that will be affordable to local government to put up. And we believe when that is rolled out, then we'll be able to gradually phase out all the challenges that we have currently with our meat handling practices.
You're working without a meat inspection law. I guess that is a challenge too.
Well, some time ago, we had that challenge, but like we have rightly pointed out, a new Public Health Act has now spelled out and given certain mandates to some of these institutions to carry out certain activities. And we believe that has overcome those challenges that we used to have.
And so perhaps the Ghanaians should be thinking of partnering the authority in ensuring that the meat we consume are safe. But first of all, in terms of getting the meat safe for the market, when the meat leaves the abattoir, the authority, do you have a role in ensuring that it is safe?
Well, that role is rightly, like Dr. Kikimoto pointed out, it's carried out by the veterinary services officials. They are trained veterinarians who are there checking, doing the pre-mortem and then the post-mortem examination of the animals before and after it's been slaughtered, right? And so the meat leaving that facility, as far as the quality and the safety is concerned, the veterinary services are doing that. We will go there, check the hygiene of the facility, and then we equally do that on the slaughter slabs of the slaughter facility. We are coming up with a licensing regime for vehicles that will even transport the meat. And then when the meat gets onto the market, then we come to work again with the veterinary services, not the veterinary services, the local government authorities, the environmental health officers, who are stationed on the market, ensuring that at the market, the meat is even sold under conditions that will make the food safe. Okay, then when the buyer comes to buy the food, finally, meat, going to a home to cook, then again the Food and Drug, through its public education outreach programs, comes out with training or what they call it, show discussions or what have you. Right. That will let the consumer know exactly how to handle the food. So you realize that along the chain, I have mentioned several players, and each of these players will have to play their role. And I don't want us to take away the responsibility of the consumer, that he or she finally will have some responsibilities, ensuring that the fish and the meat that he or she is buying will be handled in a very safe manner. So all these things have been thought out, and then we believe that through the collaboration that we have with all these state agencies, if we work together, we'll be able to provide that level of safety of meat that we want in this country, and then we will definitely do that.
Thank you so much for speaking to me. Mr. Kofi Osei is a Principal Regulatory Officer of the Food and Drugs Authority. Dr. Kikimoto is still here. Let's stay particularly, there's a call for meat inspection law, but the challenge is the legal abattoirs. How can we control these?
You know, as Kofi Osei said, you see now with the passage of this new Public Health Act 851, you see that 3 main actors are here.
Right.
that the local assemblies, who are the owners of the slaughter slabs, slaughter points, slaughter houses, or the facilities, then the veterinary services will be in charge of the meat inspection, that is the antemortem and postmortem.
Right.
To make sure that all zoonotic diseases that can be contracted by human beings are prevented. Then the Food and Drugs Board will register the slaughterhouse, you see, and they will also be in charge of the hygiene
at the
slaughterhouse. So you see that all these three stakeholders are working together. Then now, after the inspection, the meat is transported. As he said, they will introduce a new licensing method for. They want to make sure that vans that come for the meat have a cold chain, that the meat can be stored, it can reach the destination, the market in safe condition or in a good condition. Then, if they don't register it, the slaughterhouse, you mean that slaughterhouse
is illegal.
It's illegal.
But the FDA is suggesting that definitely they have a challenge. Now, this means that there are several slaughter slabs, as you put them, that are operating illegally, and that is a danger to public health.
Yes, and that is why, as he rightly said, we went.
Yesterday on Joy News Exclusive, for instance, we showed certain slaughterhouses. I wish our producers would quickly pull that one and show slaughterhouses that are working with very dirty water and the environment really terrible.
You mean those are illegal? And I was actually called by my director early morning and told me about it. We were supposed to go there, but we don't go there alone. We normally go Food and Drugs Authority. And then the district assembly, then we close the place down. That is it. If we locate it, we'll close it down.
But if you don't, it means that they're operating.
If we don't, they will operate for some time because if nobody reports, there are those kind of places, they are not at places that you can easily locate. If you look at where they should, it looks like somebody's house or something.
Yeah.
So that one, sometimes it's very difficult because of our numbering system of the houses we have. Due to the type of rules we have. But finally, it will be known. Once the media is around, they will fish you out.
Now, getting these illegal operations out is one way of achieving or making sure that the meat we're consuming is safe. Now, apart from that, like Mr. Kofi Esau said, when the meat leaves the abattoir, what or how should it be handled in getting to the market?
You see, the handling of the meat is something that, as he rightly said, it is the duty of all of us. Okay. Because, for example, if meat is transported in a van, which is registered by the Food and Drugs Authority, you must be sure that that meat is safe for human consumption. Then when it reaches the market, they will have another role to play there with the Sama, we call the environmental health.
Right.
Because
they play a very important role.
Yeah, they play a very important role because initially they were supposed to have been taking care.
Dr. Kikimoto, you can see what is happening here, for instance. This is an illegal abattoir.
That is it. That is it. This is illegal. So here, if you go, you will not see any veterinary personnel there to do meat inspection because it is not captured in our documents. And it's not captured by Food and Drugs Authority.
And this is not how abattoirs are supposed to operate.
No. This is not, we would even call it a slaughter slab.
Right.
It's a slaughter slab. The abattoirs are rare structures.
And this is the water they use. The water is not covered.
No, it's not covered.
And it is a danger to public health.
It is true. You are very correct. Because there are a lot of microorganisms there. You can even see the sewage water, salmonella. There are a lot of diseases that you can contract from such a thing.
And you see that now this place is certainly not washed, and then especially the use of rubber ties in singeing the animal.
Yeah, you are very right, because these rubber ties, they actually produce carbon monoxide, which combines with the blood of the person, displacing oxygen. The person can suffocate. It can cause cancer. It can cause skin rashes. There are a lot of diseases that this thing can cause. So we are also always advising the public that it is true that you don't know the source of the meat.
Right.
But when you go, from now onward, now that the right is given the veterinary services to carry out both antemortem and postmortem, you see a stamp
On the meat.
On the meat.
You have to look out for it.
Look for the stamp of the meat. And the butchers will always leave that stamp because they know that when they come, if the buyer comes and he doesn't see the stamp, it means he won't buy. Yeah, so these are the new measures we are working in collaboration with Food and Drug Authority.
And we have seen some of these measures taken to ensure public safety, and yet there are challenges. I mean, this stamp you're talking about, can't it be faked? You know, we have FDA stamps being faked, standard board stamp. Can't it be faked?
No, you see, this one is going to be under seal. It's not going to be just like an ordinary stamp for papers or letters that you sign. No. It's a seal. It will be very difficult for anybody to imitate it because it's going to be brought down from somewhere, which we don't want to mention, and it will be capped in our own way, how it will be spelled out in the law. Yeah.
And that will ensure that it cannot be faked anywhere. Now, let's look at this. Those who engage in the handling of the meat, you said that you have a public environmental officer who will be there to check the meat. Now, those who are working on the meat, how are they also protected in ensuring that perhaps they themselves do not have some diseases that they are transferring to the meat that will be consumed by the public?
Yeah, you are very correct. All these are the ones that my colleague Osei was talking about. Mr. Osei has let you know we normally call the technological line of production of meat.
Right.
From farm to table. All these lines, there are stakeholders who are supposed to work from one angle to another angle. Another person will take it from there. So the environmental health people who are going to be controlled by Food and Drugs Authority or local government people, they will make sure that protective clothing, they will go and test the people for tuberculosis and other diseases that can easily be transmitted between the animal and the human being. Yeah, that is how they are going to work.
Let's look at the district assemblies, the collaborative effort, the veterinary service and district assemblies. Now, you said earlier that these abattoirs are under these assemblies.
That is it.
What is your role in protecting the public where we have these abattoirs?
No, they have never known their real role. That is because, as I said, when veterinary services moved out from the Ministry of Health in 1920,
right,
we left all the functions of meat inspection with the Ministry of Health. And later, due to modernization and that thing, they went to Ministry of Local Government, Environment, they call it Ministry of Environment something. So those environmental health people, they were even inspecting meat in slaughterhouses. And you yourself could know that with even the veterinary medicine, which you studied for 6 years,
right,
you cannot know all the 4,198 diseases that affect these animals, let alone somebody who has not gone through that. So because of all these things, that is why this new law has come to rectify what we're doing. You see that most people are dying now at very young age because of what we eat.
And especially meat is a major factor.
Meat is a major factor. You know, you can't eat only TZ or Tozafe like that, no. So because of that, now the right thing is to be done in this country. And with this kind of leadership, we have the Food and Drugs Authority and then the Veterinary Services, Public Health and Food Safety Unit. We are going to see a lot of changes in this country.
But the Food and Drugs Authority has challenged, a lot of challenges. Let's still stay on the assemblies. Now, they control to some extent these abattoirs. Can they be taken on by the veterinary service? If, for instance, an illegal abattoir is operating and it gets to your notice.
And that is, if it gets to our notice, we are going to call Food and Drugs Authority, we are going to go to the district assembly, and we are going to close it down. Straight away. The law mandates us to do that.
To close the illegal abattoir down?
Yes, we'll close it down.
In cases where clearly assemblies do not have abattoirs, how do we resolve that?
Yeah, you see, that is why, as Mr. Osei was saying, there's going to be a prototype type of slaughterhouse. Every slaughterhouse is structured in a certain way. You have where the larder, where you bring the animals, they rest. That's why Professor Texan was talking about animal rice.
Right.
They have to rest. You have to give them water to drink. They have to rest there for about 3 days so that you can see whether they have even transported a disease from one place to another. Then after that, you take them for slaughter. After slaughter, they will go through this thing. So through all this process, we are going to make sure that these structures really work. And if the collaboration goes on very well due to centralization of the district assemblies. For them to really realize that, look, you owe the people of Ghana life.
Right.
And not follow money and kill the people. They will understand.
You're making it so simple that they will simply understand. Now, if you look at certain places around, just don't go far. The Wutu Senya East Municipal Assembly, Kaswa here, there is no abattoir there. And the slaughter slab there is not what perhaps I'm sure you would want to. I don't know if it has come to your notice.
I have even been there. I've been there twice. The first time, Heritage broke the news. The following day, I took my car. I went there. I went to where they have been the slaughter. Even one of the clips you showed seems to be like that area.
Exactly.
So I've been there. And from there, I went to the new slaughterhouse that
is, we'll show that one for you to see. It's been sitting there for the past 5 years.
Since 2006.
Right.
So from there, I went and met the district chief executive, Alaji Nuhu. Only a dream meeting, so I met the coordinating director. They assured me that by 31st of March, because that was in February, that they would have finished the slaughterhouse and then they will move there. Up to now, they are now telling me that in December they will finish. And I will go there again.
And is there no law that can push them to yes, this is a new slaughterhouse in Kaswa there
around the timber market.
Yes, and yet
I've been there.
And yet this is a new slaughterhouse. It's sitting there. It's not being used.
Yes, I have been there.
For the past, you said 2006.
2006, yes.
It's been there. This is a very beautiful edifice, and yet animals have been slaughtered very close to a gutter that is virtually killing people. Can't there be a law that will ensure that assemblies should provide places for slaughtering animals for their people?
I think there's a bylaw, 1451, that does not allow animals to be slaughtered in the first clip that you showed.
Right.
But, you know, normally, Ghana is not that sometimes the laws are not there, sometimes the enforcement. But I think that with the leadership that we have in the Food and Drugs Authority...
Who should enforce these laws?
We have regulatory bodies like the Food and Drugs Authority.
Right.
Now they are going to combine with the Veterinary Services Directorate and then with the District Assembly. We will go there as stakeholders and we are going to close down the place. We will close it down.
And so for how long can we see this practically being done? Perhaps the Food and Drugs Authority, the veterinary services, all stakeholders coming together, going around and closing down these abattoirs.
No, that is, for example, the Kaswa one, because when I went there, they gave me assurance that was in February I went there. They told me assurance about 21st of March, they will move to the new place. So when they didn't move, I had to go back there. And then they gave me reasons that, due to this and this, so by October, we'll finish. And last I went, and they told me December. So what I will do is that I will get in touch with the Food and Drugs Authority. We are going to the new district assembly, where they are located. I was there. And then we are going to close down the place if they are not going to do what is right.
That is by December if they refuse to open the new abattoir.
I bet you, before October ending, I'll go there with the Food and Drugs Authority and we'll go there and close it down.